If you're suffering from sciatica, pain that radiates down your leg, which is severe, then this exercise regime is to be done first thing in the morning. The reason why it's different from other exercises during the day is because often we are stiffer in our backs first thing in the morning, and so we need to do it in a more gentle and controlled manner. So try these top 4 exercises to help you get going first thing in the morning. So before I get started on the first exercise, it's worth mentioning that when we are getting going in the morning, we've usually had a period of time where we are still, relatively speaking, overnight, and that means that we're going to be stiffer. And so we want to do things gradually. We want to do it slowly, we want to do it gradually, and we certainly don't want to increase our pain. Now in this instance, I'm going to be lying down on a mat, but of course you could do this before you even get up when you're lying in bed. But the first thing we're going to do is some lumbar spine rotations. But the key part of this is that we do it very slow and we do it in a small amount of range. We're not going to excessively try to stretch ourselves. Think more mobility rather than stretch. So we lie down on our back. From this position, we're going to keep our knees together with our arms out slightly to the side, and just for a small tilt over to one side and then the other. Just rocking slowly, not too quickly, from side to side. And we're just going to count to 10. The feet stay roughly where they are. They can lift up, but they're not going to shift across to one side. And it's just easy range. And when we're doing these exercises, we can do this actually for quite a long period of time. We might choose to do this for 3, 4, 5 minutes, just continuously, gentle movements from side to side. And this is mobilizing the lower back without load on it. And so therefore, it's a flexibility exercise to just get everything loosened up a little bit. But if we try to force it too far and really try to take our knees down, then we could stress the tissues that are tight, which could be uncomfortable and could also pull things. So we're going to just keep it nice and easy in an easy rotation, very slightly from side to side. So that's exercise number 1. Now for exercise number 2, what we're going to do, well, we've got 2 options. The first preferable option is that we're going to cross one leg over the other. And so we're going to put our foot, our ankle, on the top of our knee on one side. And the motion is we're going to bring that knee towards us and then push it away. We're just going to actively do it. We're not going to grab it. We're going to pull it towards us. We're going to push it away. And so it's just these small movements, which I would recommend, again, that we do slowly. And it might not be an excessively big range, but it's just going to loosen up our hips. And if you can't manage this, I'm going to show you an alternative position in a moment as a substitute. But if you can manage it, then 20 repetitions on one side, put that leg down, and then bring your foot up. You might need to give it a helping hand just to that position, ankle on the top of the knee, and again, we draw it towards us, we push away. So the knee comes towards us, we push it away. But we're doing it actively and slowly. Repeated motions, small oscillatory motions to help loosen, mobilize, but not stress. So after 20 repetitions of that, we're done with that exercise. But if you are struggling, you can't put your foot, you haven't got enough flexibility to put your foot up on your knee, then an alternative would be simply to grab one leg. If possible, put the other one down straight. If it's too uncomfortable, you can keep it bent. Just bring it up towards us, release. Up towards us, release. So just little motions, and say not too quickly. If we're able to put our leg down, as I say, comfortably, we can just do 20 repetitions of lifting the knee up towards us. Now we're not going to stretch the leg out because that can put the nerve on stretch. We're keeping it bent. We're just bending it up and down. 20 repetitions on each side. So then we go on to the third exercise. So the third exercise is on our side. And so our knees are slightly bent. We're in a comfortable position. It doesn't matter if this is the painful side uppermost or down. We're going to do it, if we can, on both sides. Okay, so supported head. We're going to put our hand, our top arm, out in front of us and then lift it up and stretch it back. Forwards and backwards. It might be we can only go so far and come back. But this is called an open book exercise. We're following our hand with our head, with our eyes, and we do 10 repetitions on one side before repeating this exercise on the other side. This opens up the lower back structures and helps to mobilize through our lower back without load because we're on our side. Now at this point we're going to sit on the side of our bed, bring ourselves towards the edge of the bed and basically then do some sit to stand exercises. Now sit to stand exercises are really great because they help to move us from a flex position to an extended position. They engage muscles, and if we do some repetitions, some small repetitions, it can be a useful way to loosen us up to get the day started in our lower legs as well. So on the edge of a bed, as I say, use your hands if you need to on the side of the bed, on your knees, or if you're able to, not at all, put your hands out in front of you, lean forwards, stand up, lower down, slowly. Notice we're not doing it quickly. We're just standing up and sitting back down again, just on the side of the bed. Really looking as we do a few repetitions, say between 5 to 10 repetitions, extending that lower back and starting to loosen up. And once we've done those, we are ready to go and improve our mobility from the get-go, and hopefully we'll feel better with just a few minutes of starting to do those exercises first thing.